All right, welcome to Life Extension Live. I'm Dr. Mike, and this is
Dr. Crystal.
On today's show, we're going to be talking about atrial fibrillation. It's one of the most common arrhythmias
Yes.
in the world, actually.
And when we look at some of the risk factors, you'll find that you probably have those risk factors.
Well, if you're getting older, you're a part of it. That's one of the big ones.
Yes.
So we're going to talk about what AFib is, but really we want to get into more like what are those triggers you can minimize? What are the types, and what are some of the things you can do to minimize those types, and even some conventional and
nutritional
add-ins.
Yes.
Right? So let's go ahead and get started again, just real quick on today's show. Who's at risk? Strategies to minimize triggers and nutrient add-ins. Oh, and specifically before surgery. We're going to get into that because that's a big time to get AFib.
Yes.
All right. So let's get into this. How would you describe at a basic level of knowledge what AFib is?
Yeah, it's a quivering of the heart.
Quivering
I would say
of the top part.
Of the top part. So when you think about your heart, you've got your four chambers, right?
Yeah.
The two top, the atrium, the ventricles, and the atrium is kind of like boom, and this pushes blood into the ventricles, and then the ventricles out to the body.
Right.
So the atrium is what's kind of receiving that blood.
Receives the blood. It triggers the heartbeat.
Yes,
That
that's
brings
where,
it out. Yeah, there's a place in the atria called the SA node. We're not going to get all that.
But it's the pacemaker.
It's the pacemaker.
The natural
pacemaker in the heart. And it does what we call sinus rhythm. Just would be lub-dub, 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 right? But in AFib, there usually are little other places other than the SA node that start to kind of trying to become unruly and run the rhythm themselves.
Very true.
And they start firing, and now the atria gets confused. It just starts, and that's AFib.
I love that. I love that. The other firing places.
Yeah.
Trying to outdo the natural pacemaker.
Yeah. For most people, here's what's interesting about it. For most people who even have AFib, maybe it's constant or they're going through episodes of it, we'll get into that. But when you talk about symptoms, most people don't even know. Right. It's found on random EKGs at a doctor's office. There's famous people who were found like that.
That's right.
One of my favorite stories, do you know Larry Bird?
Of course, with that three-pointer.
Oh, wow, from the Celtics.
How am I not going to know Larry
It turned
Bird?
out, I don't know the whole story, but it turned out his AFib was discovered at a random, doctor's visit.
Yeah.
They put him on a monitor. He was in it a lot. Turns out he was probably playing with it.
Yes.
Didn't even know.
And just to be clear, without a tangent, it's a form of arrhythmia.
Yes.
Which, you can have a rapid heartbeat, or your heart rhythm could be slower. Well, let me clarify, because there's speed and then there's rhythm. And so what we're kind of looking at here is kind of the rhythms
It's
off.
more the rhythm, but
Right.
it also is labeled as a tachycardia, a faster rate, right? So when you're so again, if this is normal, lub-dub, right? AFib sends these random signals because it's fluttering, right?
Yeah.
To the ventricles, and so instead of lub-dub and nice rhythm, it's more like lub-dub, 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 lub-dub. It's like that. It's fast, it's irregular, classic AFib.
Yeah.
Okay, was that good?
That was great. Yeah, I just wanted to kind of clarify where that fit in with other kind of heart speed issues.
Yeah, it's overall listed as a tachycardia. So most people don't feel anything. Now, some people will you can feel it.
Some
it flutters. It can be, when that starts to happen, it can be very, concerning. But the one thing we should let you know is that AFib in and of itself, even though it feels funny for people, or maybe you don't even know you have it, but it's the rhythm itself is not the issue. You can survive with AFib. The ventricles, they're gonna get some signals. They're gonna pump. They're gonna get blood to your body and your brain. Yeah. Just maybe not in a nice
synchronized manner.
Synchronized manner.
Yeah.
So it's not really the arrhythmia that's the issue. The main issue is when that atria is not pumping right, blood can pool.
And then that's increasing your risk for a stroke.
Right. And that's the real
big
issue.
thing.
That's
right.
the real issue with AFib. Other symptoms that people will have, you want to go through some of these. Fatigue, that's very common. Again, feeling that rapid, irregular beat. Shortness of breath can even happen. Sweating, chest pain. But here's the thing. For most people who are overall healthy with AFib, what I have seen in clinical medicine is they don't have really those. They may feel it. It doesn't feel good. Maybe that causes a little anxiety, just feeling that. But in and of itself, they're not passing out. They're not sweating. It's when you already have an underlying condition.
Like congestive heart failure.
Congestive heart failure. If you had a heart attack in the past, a valve problem.
Post-surgical, open heart surgery.
Yes, those kind of things is where you start seeing these other symptoms. Yeah. Again, we kind of covered this, what causes it.
Yeah. Yeah,
it's just these little places. They get a little, hey, I want to do it now. Shut up, SA node.
And if there are only maybe 4 or 5, the doctor can sometimes locate those.
We're going to talk about that.
Yes, but sometimes it's
you can't. It's everywhere.
Figure it out, and
it's diffuse, and there's not. So it takes more medicine and stuff like that. So that's really all it is. It's just these little other places wanting to act like the SA node. And they cause a rapid, irregular heartbeat. That's pretty much the end of that. Let's talk about who's at risk.
Okay, well, you already said older age.
Yep.
Cardiovascular disease.
Just right there.
Yes. Coronary artery disease.
Yep.
Congestive heart failure, high blood pressure. Can I just say chronic inflammation?
Sure. So underlying of all age-related disorders issues.
So,
sure.
Of course, family history of smoking, obesity, diabetes. Also, hyperthyroid.
Hyperthyroidism
is one. There was one that sleep apnea.
Sleep apnea is another big one. If you're having those periods of when you're not breathing at night, that can actually activate and stress the heart.
Yes.
Causing those little places to start firing.
And then alcohol consumption.
Alcohol consumption. There's actually a term for this, right? It's called a holiday heart. Have you ever heard of that?
I heard you talk about it.
Yeah, it's one of those things where someone doesn't drink a lot, but then around the holidays, or they go on a holiday, which is a vacation, and they binge.
Yeah.
And their body's not used to it. And that can often lead to an AFib episode.
Yeah, and this is like the day after. Is this kind of a part of?
It's usually a little later.
Later, right?
It's not. No, it can happen anytime. AFib, but it does seem for most people to be after their body has been metabolizing. Like they stop drinking. There's a byproduct to alcohol called acetaldehyde, which is what we think is causing that. So that kind of goes up a little later. Maybe causing AFib. But no, there are some people that say, I had 2 beers and I felt it. So it can kind of happen, I think, anywhere.
Yeah.
So those are your list of risk factors. And again, just remember, I don't know what the percent is, Dr. Crystal, but people over 70, it's 30, 40% probably have AFib episodes and don't even know it.
I can believe it.
Yeah. Okay, let's get into more stuff here, right? I think we already talked about it's not the rhythm that's so dangerous, right? It's the pooling of the blood, a clot forms, and then you go into normal rhythm, and now that clot shoots up into your brain, right?
Yes, then we do have some stats here.
Right.
So if that happens, you're 5 times more likely to have a stroke. So it's very serious. And then we have 15 to 20% of strokes are caused by atrial fibrillation.
Yeah. And then, of course, we worry about if you have heart failure already. That's, AFib makes it, so if you have heart failure, you probably are already aware you follow your ejection fraction. That's how much blood is actually being pushed out by the ventricle. The amount that comes in versus what goes out.
Ejected. Right. That's how I like to think of it.
And that's already diminished with people with chronic heart failure. And so having AFib in those moments, your ejection fraction can really drop.
And then some people with AFib, we have here with the worried about dizziness and falls, because sometimes the heart sort of stops a little bit. There may be 3, 4, 5 seconds. Yeah. And then those people kind of have these dizzy spells, and that's also dangerous.
Yeah. And I think that usually happens too in the context of maybe you already have some atherosclerosis, coronary artery disease.
Yes.
You already have trouble getting blood up to your brain anyways because of blockage. And that's when you see some of the dizziness. And we don't want to fall. I mean, we should do a whole show on falls. I mean,
we should.
Let's
write it down, Hannah.
As we get older,
put that on the list.
As we get older, that's you're in your 70s, you fall and break something. That has a mortality to it. Yeah. Anyways, okay. So how are we going to diagnose this?
ECG, and I told you my doctor hooks me up once a year. It surprised me the first time I went in, and you're so used to the cough. Well, it's actually the medical assistant. And they say, okay, take off your shirt.
Take off your shirt.
Like, what? Okay.
I just met you.
Okay. And they hook me up, and so that's something that I've had, the past 3 years routinely.
Yeah.
And then that's how the doctors can just kind of find it.
You can, yeah.
By chance.
It's by chance.
If it's happening at that time.
If you're somebody, and I think that's coming up next. Yeah. Let's just real quickly say that there's kind of 3 main types, right? There's what are known as. Well, I guess you could group these. Let's say there's 2 main types. There's what is called paroxysmal. These are either sporadic or periodic, meaning you're not always in the AFib. Sporadic, these could be quick little episodes, 30 seconds up to 3 hours, I've even seen some sources say days, whatever. But you come out of it. You naturally convert out of it. Periodic is usually longer, up to a week or so, but again, you come out of it without any help, medicine, or anything like that. But then there's consistent. And this is what anything over, I think, a week. And these people usually are not coming out of it. This is where Larry Bird fell in, was categorized with. And these are the ones that, it's the periodic and the continuous that we really want to make sure we're doing everything we can to prevent stroke. Sporadic may not have that same stroke connection. We don't, because if it's happening quick, there's some new paper.
We saw something recently this week that related to kind of the sporadic, short term. We and the risk associated with those occasional kind of flutters.
So there's a lot of cardiologists, people who really study this stuff. They're just starting to question some of those older studies where some of the stroke risk data came from. It's still a risk. They're not changing that. It's just how much of the risk is it. And so it's just interesting. But right now, listen, it's a risk. If you're periodic, you're continuous, we got to make sure you don't have stroke.
Yes, and I think that takes us to kind of back to how it's diagnosed. You can ask your doctor. Sometimes they have the monitors that you can wear. Yeah. And so if you're unsure, if you're kind of worried, then you can wear the monitor. Some of the smart ones will feed back to the doctor.
When I started medical school, the monitors they had for that kind of coverage, it was like a TV box these people had to carry around. They had to carry around their neck. And they had all the this was crazy. It's not like that anymore. It's pretty simple. There's even FDA approved like little devices you can put your fingers on, and can catch it. And but anyways, so it's not just the random EKG, which is not really reliable for that because you have to be continuous, right? Or you got lucky and they caught it. And that's where maybe if you do feel that fluttering, check your own pulse. It's rapid, it's irregular. Tell your doctor, maybe a 24-hour monitor. Yeah. I do want to mention that we're going to get into treatment now.
Yeah.
Things that you can do to help mitigate AFib and the effects of AFib, both conventional and natural, right? But before I do that, I want to talk a little bit about the sporadic type. Because the sporadic type, again, these are quick episodes for people. Some people will say they feel it for a couple minutes and then it's done.
Yeah.
Others say, well, maybe it was kind of all night, but by the time they woke up, it was done, right? And so for those sporadic ones, there's some things that can help. Already we know, limit the alcohol.
Yes.
If caffeine is your issue, if that's a trigger, limit that. Also keep in mind, a lot of these sporadic episodes happen at night when you're falling asleep. So sleep on your right side, not your left side.
Right, which is different than what I would typically say as a nutritionist.
Because
but
the left
listen
side,
to him in this case.
the left side puts more pressure on the pulmonary veins, and we believe that pressure plays a role in activating some of those ectopic foci, is what they call them, that get all crazy with the AFib. Just think about that. And then there's Valsalva maneuvers you can do, which brings yourself out of it, out of that rhythm. You just bear down. It's almost like you're going to the bathroom.
Yeah, and sometimes you close your nose, right?
Technically, you're supposed to sit up straight, like on the end of your bed. Let's say it's happening at night. You sit up on the edge of your bed. You close your nose. You take a deep breath in and you hold it for about 5 seconds. Keep your mouth closed, and then you bear down, and you bear down for 5 seconds.
Okay.
And that often, now it may not work. You may have to do it a couple times. Usually can work for people that have sporadic. Yeah.
I love it when we can give kind of things that they can do at home.
Well, you know what's even
the lifestyle.
I know we got to keep going, but real quick. Well, you know what's even interesting? Coughing itself. Coughing is a Valsalva maneuver. That's part of that increases your pressure.
Yeah, and it's all about stimulating the vagus tone, right?
Yeah, and I've always noticed if you're in a cardiology office and you know some of these patients have some of these arrhythmias, you will hear them. They don't even know they're doing it. They're coughing. They're not coughing because they have stuff that they're doing Valsalva maneuvers just subconsciously.
Wow.
Yeah, they're like this. They're fixing a rhythm, and they may not even know it. Interesting, right?
So cool, Dr. Mike.
All right, let's get into conventional treatment medications. What do we got?
Okay, so blood thinners, number one, usually anticoagulants. Some doctors are kind of getting away from the warfarin and maybe some of the other types that you may not have to monitor.
There's easier blood thinners to work with nowadays. Yeah.
So blood thinners, of course, because of course the risk of stroke is up. So we're trying to kind of keep the blood flowing. Calcium channel blockers, which can help to sometimes slow down that rhythm. Yep. Beta blockers as
same
well.
Thing. Yep.
Same
and sometimes
idea.
in combination, you'll even see those used.
Yep. Of course, surgical procedures, the pacemakers.
And that's going to be reserved mostly for people who are really having symptoms with this. And we got to keep them out of that rhythm. That's not as common to do.
Yep. And then we talked about kind of non-surgical. Trying to reset that heart rhythm.
Yeah, there's ways you can do that. You know, in the way the Valsalva does it is kind of the same thing. You can kind of do these little shock things, and the heart will just get in a normal rhythm. Or the one that's really cool is if you have a couple of those places where it's firing, it's not supposed to, they can go in there and they ablate it. You're dead. And it does form a little scar, but it's not going to
So then that area in the heart will stop firing.
It stops firing. Yeah, it stops. And now, that only keep in mind, some people have hundreds of these places that fire, and you can't do that. That's only for a few. But so most people, blood thinners, calcium channel blockers, and beta blockers. What about, let's go into your world.
I was going to say, I'm excited about this.
Food. Tell us about food.
My world is really just think about whole food, plant-based diet. I'm going to keep it very simple. Try to limit the saturated fat. Try to limit conventional meat to maybe once or twice a week. Look for your grass-fed. But really, the whole idea here is more plants, fruit, vegetables. You need to decrease inflammation in the body, decrease oxidative stress, because we know that plays a role. And we have research showing this type of eating pattern can kind of get rid of some of the atrial fibrillation.
Yeah, there's even data for the Mediterranean diet, right, showing that people that, even if they barely adhere to a Mediterranean diet may have less of a chance of a risk of AFib. So that's fantastic. There are some nutrients as well, some nutrient add-ins. The first two are, I think, critically important for anybody. If you're over the age of 50, you're going into surgery, really for any reason, but especially if it's for anything with the heart, right? Valve stuff, whatever. Vitamin C and vitamin E before you go into surgery can stop what are known as post-op AFib episodes.
Yes, and we do have this. You all will see later at the Life Extension protocol. It gives you the specific dosing of the vitamin C. It's 1 or 2 grams before surgery. Really reduce those AFib episodes post-surgery. So those are 2 to think about. Vitamin C, vitamin E.
Yeah. You got to talk to your doctor and the surgeons for that. Yeah, you got to make sure you do that. But let's go on to vitamin D. When do we not talk about vitamin D?
No.
But and I love it. We should. You want to we know that if you're low in vitamin D, there's an association there for AFib.
Yes, and we see 2 different doses, a mega dose and a low dose. So 16,000 IUs or 3,200 IUs with a placebo for 5 years. Both doses were associated with reductions in AFib risk, 27% with that higher dose and 32%. So, that's vitamin D. Make sure you test your levels.
Love it.
Make sure you optimize.
So simple.
Yes.
CoQ10 is next. So simple.
Oh.
Coenzyme Q10, ubiquinol form, so simple, has been used for decades
to stabilize and normalize arrhythmias.
Yeah, I mean, just fantastic. And if you have other risk factors like heart failure already, I mean, hopefully you've already talked to your doctor about CoQ10 and you're already on it. To be honest with you,
should be
other nutrients that maybe we don't have as much evidence as for like the A, the C, and the E, and D, and CoQ10. But these are they're just good heart nutrients. Magnesium. Magnesium has been studied in a lot of other arrhythmias, showing a lot of benefit, not necessarily specifically AFib, but I gotta tell you, magnesium is so important to those electrical signals in your body, not just in your nerves, your gut, your heart. Get some magnesium on board.
Very true. And then there, again, some mixed data with omega-3s, but it doesn't hurt to just kind of make sure you are optimizing your omega-3 status when we go back to inflammation, decreasing inflammation in the body.
Lastly, I'm going to mention glycine. This is, I think, we don't talk about glycine as much as we do some of the other nutrients, but glycine... and it's great for sleep, by the way. You do it that.
I do. I do.
I do too. Glycine is great. It's wonderful. But it also has been shown to have, like vitamin D, if you're low in glycine, there's an association with AFib. So get 2, 3, 4. You could go up to 5 grams of glycine a
5
day.
grams. That's a good dose.
Yeah. So there you go. There are hopefully some strategies if you're dealing with AFib.
The triggers
to minimize it. Know those triggers. If you think you're dealing with this, please talk to your doctor. There's different ways to diagnose this and ultimately treat it with nutrition and or conventional medicine, maybe even a surgery. Maybe you're that kind of candidate.
Yes.
Yep. So we have another, I think, a really good protocol.
We do.
From Life Extension. If you go to lifeextension.com/AFib, you can read in much more detail Life Extension's protocols. Let me tell you, this is rigorous science stuff.
Very true. And you can get, again, the dosing for that vitamin C study.
Yeah, and don't forget, when you're at Life Extension, again, that's at lifeextension.com/AFib, you might as well shop around because if you use the discount code
LE Live,
you get 10% off $50 or more plus free shipping and handling. So why not? Go read the protocol, get yourself some good nutrient add-ins at lifeextension.com/AFib. We go live every Wednesday, 12 noon Eastern time. So wherever channel you watch us on, because we're all over the place, like, interest, ring, thumbs up, do whatever you got to do so you know when we go live. We appreciate comments, likes, and we love shares. Help us get these shows out there. That would be fantastic. That's 12 noon Eastern time every Wednesday. I'm Dr. Mike Detz.
Dr. Crystal.
We'll see you next time.